Welcome to the Central Line Maintenance video series. In this fourth video, we will demonstrate recommended infection control practices for changing a central line needleless connector. First, ensure the trolley and trays are thoroughly disinfected with approved disinfectant wipes. Next, prepare and organize the required supplies for the procedure. Perform hand hygiene according to proper steps and timing. Optimize the patient zone to maintain aseptic technique. Perform hand hygiene and don clean gloves. Peel open the needless connectors package, exposing the hub end of the connector. Maintain connector sterility by keeping the unused end protected within the package and avoiding contact with the open hub. Use the first swab to scrub the hub of the connector for 15 seconds. Then allow the hub to air dry completely. Remove the syringe cap, then connect the sodium chloride syringe to the connector hub. Hold the syringe upright, then push the air out. Discard the used gloves. Perform hand hygiene. And don new gloves. Clamp the central line tube. Use the second swab to scrub the connection point between the old needless connector and the central line tube for 15 seconds. Then remove and discard the old connector while holding it with the alcohol swab. Use the third swab to scrub central line hub for 15 seconds, then allow it to air dry. Connect the new needless connector to the catheter tip, and slowly flush the line. Cover the needless connector hub with a new cap. Discard used gloves, perform hand hygiene, and document the procedure as per local protocol.